Free Medicare plans? Is there such a thing as a Medicare plan that doesn't cost me anything? What's up, friends? Rob here with Agape Insurance in North Mississippi, and today I'm going to be answering these questions because you probably have seen these commercials on TV where it says zero premium, and then you see all these extra benefits added with these particular plans, and you're probably thinking, is this too good to be true? Well, I'm going to answer that in the next few minutes through this video, but before we dive into that, I need to make you aware of a couple of things. That if you're on Medicare now, or especially if you're new to Medicare, there's really two main options or two main routes that you can take when it comes to Medicare. Number one is the original Medicare route. That's with your red, white, and blue card. And then you add a supplement to that. You add a standalone prescription drug plan, and then any other ancillary plan that you may need to fill in the gaps of Medicare. Route number two is the Medicare Advantage plan, or Part C, or it's also referred to as a managed care plan. And this is what these commercials are talking about. If you see something about free plans, if you see something about a zero premium, zero cost plan, this is what they're referencing is Medicare Advantage plans. So I'm going to dive into that real quickly. But before I do that, I want to just remind all of you, please like, comment, subscribe below, turn on your notifications. That way you're notified every time we drop fresh content like this. This just helps us help more people by getting found in the YouTube algorithm. So once again, option number one, original Medicare, that's where we stick with the red, white, and blue. That's where the government is over our health care, and then we get a supplement, then we get a standalone drug plan and any other ancillary plan that we may need. And then option or route number two is the Medicare Advantage plan, or Part C plan. And here's really the main difference. The main difference is this: we're on original Medicare, the government is in charge of your health care. And option number two, that specific carrier is in charge of your health care. And here's basically the most simplistic version that I can give you, or way to explain it, is this: Medicare gives a set amount to that specific carrier for every Medicare beneficiary that they enroll. And so they simply say, here's this amount of money. Now you're in charge of that particular member's health care. And so because of that, the carrier can now pass on that zero premium or that no cost premium to you or to the Medicare beneficiary, as well as additional benefits such as some dental, some hearing, some vision. Some of them have over-the-counter card. If you have a certain kind of Medicaid, it can unlock even a grocery benefit card for you, gym services or gym memberships, and more. And so these are those zero premium, or those so-called free plans, Medicare Advantage plans, or Part C plans. Now, one thing that I want you to be aware of, or a couple of things actually I want you to be aware of when it comes to going on a Medicare Advantage plan, if you do find out that this is the best route for you. And real quickly, before I dive into that, I recommend that you call us on the number on the screen. It should be on the screen. If not, it's down in the video description. And the reason for this is because you want to make sure that you understand all the ins and outs of both options, the pros and cons, in order for you to decide which option or which route is best for you. But here are just a few things that I want you to be aware of when it comes to going on one of these zero premium plans. Number one is they're network based. So you have HMO and PPO, the two most popular types of these Part C or Medicare Advantage plans. And so therefore you always want to check your doctors, you always want to check your hospitals and your other providers to make sure they're in the network. Because if you're on a specific type of Medicare Advantage plan, you will be responsible for the full amount if you go out of network. Number two is you always want to check your medicine. Just like if you were to go on a standalone prescription drug plan, you want to make sure to review all of your medicines, and whatever advisor that you work with, that they take all of your medicines down and they put them in the computer. And that way you will know if that Medicare Advantage plan is going to cover your medicines well. I can't stress this one enough, because I see people get messed up all the time because that agent or advisor did not take the time to review their medicines. Number 3 is you need to be aware of the copays that are built into the program for going seeing a doctor, a specialist, maybe an outpatient surgery, ambulance copay, etc. You need to be aware of those copays. And then also with that is you need to be aware of your maximum out-of-pockets or max out-of-pocket. And what that simply means is this: that's the max amount that I'm responsible for in that one calendar year if I'm on this particular Medicare Advantage or Part C plan. And then finally is you want to be aware of your prior authorization. Many of the services that you'll need to get done require a prior authorization, or PA for short. And that simply means that if you try to go get this particular service or procedure done, many times they're going to require that prior authorization before you can have it done. And if they deny that prior authorization, then there's an additional appeal process that you have to go through. So this can be somewhat frustrating to people who maybe this is their first time on a Medicare Advantage plan, or for whatever reason that agent or advisor did not explain to them that prior authorizations were part of the plan. So not every service, but quite a few services and procedures will require a prior authorization, and you even see this for some medicine. So as we close today, I just want to encourage you, call the number on the screen. We'd be more than happy to review that for you at no obligation, no cost. We work pretty much in every state, and if we're not in your local state, we have a network of people that we trust that we can refer you to make sure that you understand both options thoroughly, so you can make the best decision for your healthcare needs. If the number's not on the screen, look down in the video description area and you should be able to find our number there. Well, I just want to say God bless you guys. Thank you for watching today's video, and we'll see you on the next video.